Hey everyone, we wanted to start off first with this video just by thanking Huddle Up Moms so much for giving us the platform to us and all the other birth professionals in the Roanoke Valley area for giving us the platform to speak on topics that are passionate for us and that we really find important. We are the Roanoke Doula Collective, and we are a group of independent birth and postpartum professionals, and we are really passionate about supporting individuals and families that are in the Roanoke Valley area and surrounding area as well. We have all the way from birth doulas to placenta encapsulators to birth photographers to lactation consultants, and so we have a wide variety of experienced professionals and lots of experience and years under our belts. And so our goal as a collective is to provide the best care for those that are seeking doula services specifically in those areas. So welcome. We're gonna go around and do some introductions. So just so everybody can get started and so that we can all know who we're talking with. So let's go around and do some introductions first.
Hi, I'm Anna Wetzel-Rucker. I am a professional doula, a hypnobirthing childbirth educator, and I'm founder of Mama Marie's Doula Services.
Hey all, I am the face behind Beth Farnsworth Photography. I am a birth and postpartum doula with over 5 years of birth photography experience.
Hi there, I'm Colleen Smith. I'm a birth doula with Mighty Mamas Doula Services and one of the co-founding members of Roanoke Doula Collective.
Hey guys, I'm Dominique Gallo. I am an International Board Certified Lactation Consultant, or IBCLC, and a birth doula here in the Roanoke Valley area.
Hi everyone, my name's Erin. I use she, her, and they pronouns. I am the founder and owner of Lunar Elm Wellness based in Blacksburg, Virginia. I primarily work with mindful birthing and am also apprenticing to become a doula.
Hi, my name is Tara Daystar. I am a birth doula, certified professional midwife, lactation specialist, and childbirth educator, including hypnobirthing, and the founder of Ancient Roots Midwifery and Doula Care.
So we wanted to just give you a little bit of a background on how we got started at Roanoke Doula Collective. So we really were founded on a desire to increase access to doula care in the Roanoke Valley specifically, but also the surrounding areas as well as those complementary birth services like I mentioned before. We have lots of people with expertise in certain areas that really works well with doula services. And so our reasoning for coming up with this collective was so that we could gather a group of really experienced professionals who could provide that solid care to people in Roanoke Valley.
So I know that some people on this call have had doulas, have heard of doulas, and some have no idea what a doula is. So we want to get to the meat of our talk on diversity, inclusivity, and equality in childbirth, and how doulas are making a difference. But I do want to just start off saying what a doula is, in case this is new to you. A doula is not a medical care provider, but a doula is an important part of your care team. And they are considered by the World Health Organization a very essential part of healthy childbirth. Doulas provide advocacy, evidence-based information during your pregnancy, during your actual labor and birth, and the postpartum. They also provide physical support that could be in the form of massage, breathing technique, hip squeezes, and they also can support your partner or family member, friend, whoever, what other people you might have in your birthing space that could need support in that unique environment. So that's what doulas do, and the research shows that women, birthers who have doulas report higher satisfaction with their birth experience, significantly lower rates of cesarean birth, Also, less use of any pain medication and just increased overall satisfaction, reduced use of Pitocin. So the evidence is there for doulas, and more states are looking at how to use doulas in the medical care system to reduce cost and improve outcome. And yeah, more and more doulas are here for you. So now that you know a little bit about what a doula is, I would like to share a guiding principle of Roanoke Doula Collective, which is inclusivity and diversity, and which that's kind of the headline of our talk tonight. And when we got together, we wanted not just to gather as doulas, but to make sure we were able to provide services in a way that would meet the needs of many families, many individuals in our community. And the whole point of a doula is to have someone in your court that backs you up, understands you, takes the time to understand you, and is there to promote your greatest sense of safety, acknowledgement, relaxation, and childbirth. So our goal as a collective is to support every individual and family in the Roanoke Valley and the surrounding areas that seek doula services. This means providing respectful care to individuals and families of differing spiritual beliefs, ethnicity, race, sexual orientation, and identity. Our RDC, Roanoke Doula Collective, also appreciates that family takes many shapes and forms, and we're here to support any and all forms of your chosen family. So with that in mind, we are going to share our perspectives as active birth workers and advocates for families and birthers and individuals. And I will pass this over to Beth, who will be our lovely moderator tonight.
Thank you so much, Tara. One thing that I think we should start off with is we need to talk about what the difference between diversity and inclusion, equality, and equity.
All right, so first let's talk about diversity, because we hear that a bunch. So the definition of diversity is the existence of variations of different characteristics in a group of people. In this particular instance, we're going to be talking about race and gender identity. And inclusion embraces all people, regardless of race, gender, disability, or medical need. It is equal access and opportunities for all people.
Yeah, so, and I think that equality and equity are best explained through an analogy. So if you can imagine three different folks who are varying sizes, so a smaller person, a medium-sized person, and a taller person. Equality means that they all have access to exactly the same resources. Let's say they're standing at a stadium and they each have a box that they get to see, and that box is about 1 foot high. You might imagine that I just went into the dark because my power went out. So sorry, y'all. I hope you can still hear me. But you can imagine that equality is that they have all the same size box. And equity means that the smaller person might get 2 boxes, the medium person might get 1 box, and the taller person might get no boxes, but they all have the same access to the viewpoints. So that's just a really nice kind of way to think about the differences between equality and equity. We don't all need exactly the same thing to have access to the same types of things that are around us. So that's true in the birthing world as is true in all other spaces.
That's awesome. I know that was super helpful for me. I saw a little picture meme before about that, and it definitely really helped me to understand equality and equity in a different way. So I'm curious what you guys think are some ways that doulas and direct care providers can honor diversity and create inclusive practices.
Hi, I can speak to that. So there are so many ways, and I would say this is something I'm still in process with in my practice and as a collective. But number one is just that willingness, that curiosity, and that respect for our patients, our clients. Simple things, there's amazing online resources specific to birth workers to help us change our intake forms, There are instances, many instances, where a person, for instance, who identifies as queer or wishes for a gender pronoun different than their biological gender, has faced care providers being actually unwilling to even acknowledge their requests. So if you are a care provider, being willing to honor how a person self-identifies is an amazing step. Also, the willingness to ask questions. I think even if you're really wanting to learn about the many variations of human beings and desires within the birthing space, it's easy to make assumptions, and I've certainly been guilty of that myself. So asking how someone wishes to be referred to, asking what their plans are for breastfeeding. If there is a lesbian couple, they may both wish to be involved. So making no assumptions and asking is very critical for all direct care providers. Another thing they can do is actually refer clients to doulas. Having continuous care and someone that really understands your wishes in the birth room, like a doula who you've gone over your birth preferences with, that doula can help set up a safe space for you. When you're in labor, you and your partner, or if you're with a friend, like, you might be very busy, and to have that doula support the space that you want and have those conversations for you with the nursing staff, the pediatrician, open the doors that you need opened, and help get everyone on the same page can be incredibly helpful. Another thing, we're going to talk more about this, having a diversity in caregivers, medical doctors, midwives, doulas. That's an important piece of it, and also creating affordable services, and also having more government support of doula care through Medicaid can help create a more inclusive practice. But you'll hear more about this as we continue to talk.
Absolutely. I know that we've all been really intentional about educating ourselves so that we can meet people exactly where they are. What do you think some resources are that we could give to the public and to care providers so that they can, really become educated on these issues?
So when we're looking at resources, one of the most important things that we can do as doulas, whether we're talking to, care providers, the general public, even our clients, is to provide evidence-based information to our clients. Especially, we want to make sure that what we're doing, what we're presenting, is based on facts. And yes, our experiences are a wealth of knowledge too, but we also want to make sure that those two things go hand in hand, so that our experiences are also being supported by the facts that are there as well. We want to make sure that those things are there for our clients and for the public, and for care providers as well, so that everyone can make informed decisions. And then that can be a decision that people can make themselves as clients specifically.
Absolutely. What are some tools or practices that everyone can try to help support diversity, inclusivity, and equity? Erin, do you have any suggestions?
Erin may be having issues with the power outage.
She may have frozen. Tara, how about you? Do you have any ideas?
Yeah, to add on, I know something that Erin had spoken of previous to this conversation is self-education. I know there's amazing podcasts out there that really have created more empathy and understanding within myself. There's also just self-inquiry. And I know as far as equity, removing obstacles, be they financial, there's also couples may experience not even having their chosen partner be with them in birth due to sort of only allowing people of opposite genders as like the father. So changing those practices can be very, very helpful. I just think we need more research in our society. Often the money, the the money goes where the money will be made. And so we actually lack a lot of information about birthers of color, and what we can do to improve safety. And we also, you know, the more that we invest in diverse birthers, the more safe care we can provide.
Thank you, Tara. Erin, I don't know if you wanted to take a minute. Unfortunately, it looks like it cut out right on your turn.
Yeah, so thank you so much. So in case it hasn't been mentioned, some of the tools that I think individuals can really participate in is a little bit of, or a lot of self-inquiry, self-study in thinking about how you view the world, what your lens is, and how that might be different from other people. And then with that reflection into your own self, really thinking about stepping into spaces from a place of humility, because we don't always understand other people's experiences. And if we use tools like active listening, then we get to really hear what someone else is saying to us and participate in a real dialogue with them based on our own understanding of the world. And that's, I think, how we can kind of move through these spaces. And I think it's also important just to say, like, we're all stutter stepping in life in general. So so it's okay to make mistakes and to hear someone tell you or explain to you how that mistake was made, and to just take that information in and decide how to approach it differently the next time.
Yeah, absolutely. I don't think that's just important for care providers and doulas. I think everybody should be taking time to self-reflect things like this and learn to just show love to other people and understand them better, for sure. So I know something we've talked about before was the lack of diversity we have here in the Roanoke Valley. What are some opportunities that work to address the lack of diversity in our area and just in all communities?
Well, I think we can promote, there's a couple of doulas of color in this area. We can promote new and upcoming doulas that have, you know, a unique perspectives by doing mentorships with them. Also for providing resources. There's a couple of places in this area they can take doula training. I know Crystal Mullins Fink, she's a midwife in this area. At Breath of Life Midwifery, she offers a doula training for community doula, and she has payment plans, so it's something that all people could easily take. Also, National Black Doulas Association, they have amazing programs to help new doulas that are training, also to help us old doulas. They have a workshop that's called Cultural Competency that I would like for us as a group to take, or I know I will individually at least, when, you know, in the winter or maybe the first of spring. So there's plenty of resources. We just have to get them to the people who are interested in this kind of caregiving, because it is a special kind of caregiving.
I'll add to that where I studied midwifery, there was actually one scholarship per year for a person of color to learn midwifery. I know there's also scholarships with different doula organizations, and that is to create equity. And it is hard to be a birth worker, and it takes money and time and commitment, and that we do not all start from the same place, have the same family support, the same financial resources. So if you are a person of color, you are so needed, so wanted in this field, and definitely advocate for yourself, because there are many people dedicated to helping you on this path. I also want to add that there's a wonderful program I've learned about recently. As a long-term doula, I've been invited as a stakeholder. There is a Medicaid program that's being hopefully developed. It's still in process, so hopefully the legislation will back it. But that will ideally help address some of the outcome disparities, especially with women of color, but also lower income families in general. So it will be linked to Medicaid and provide wonderful doula care before, during, after, and the hopes is that will increase breastfeeding rates, outcome, and many other wonderful results. But also they are really looking for individuals who have lived experience, whether they are themselves a woman of color or a brother of color, or that they grew up or are currently a Medicaid using family, so they understand some of the issues. So there is sort of at this statewide level, individuals who are working hard to help bring in that diversity and also make doula care a sustainable field for people to be involved in, and that too increases diversity when it's financially sustainable.
Absolutely. You had mentioned just a little bit about outcomes, and I think it's really common for people outside the birthing community to not totally understand the unfortunate gaps in the medical system, because I know that studies show that birthers of color have a significantly higher mortality rate than everybody else, which is just so unfortunate. So I have a question, and I would love to know, what are some things that we as a society need to do to address this racial and ethnic gaps that exist in mortality rates?
Well, let me first give you some stats. The CDC stats say that birthers of color, women of color, they list women, but it's birthers of color, die at 3 to 4 more times during pregnancy, childbirth, or postpartum than a non-Hispanic white person or non-Hispanics. Also, if you're 30 years old and a birther of color, the rate increases to 4 to 5 times more likely. And if you are educated, if you have a college degree, the rate goes up instead of down. It goes up to 5.5 times more likely. And those are national averages. So it's not all about the socioeconomics. Yes, we do have low income people, birthers of color that need education, that need the support. All women, all birthers need support. I believe everyone needs a doula, you know. But the birthers of color, like I said, it doesn't have to do with just the socioeconomic status. For example, Serena Williams, she was in a hospital prior to getting pregnant, and she had a pulmonary embolism. So when she had her baby, she had a C-section, and she felt the same tightness and hard, you know, shorter breath in her breathing. And she had told them, you know, I need a CT, I need some heparin, I've got blood clots, you know, I possibly have a pulmonary embolism, I've had this before. And it took them hours upon hours to get an order in. And the order came back for an ultrasound of her legs for the vascular, not of her chest. So they found nothing, of course. Then maybe 6 hours later, they finally do the CT and they start heparin, but it's almost too late. She almost died. She had a hematoma. They had to go in, and it was in her surgical incision in her stomach. They had to go in, open her back up, drain that, and then sew her back up. She was bedridden for almost 6 weeks. Had they listened to her from beginning instead of prolonging it. And then the stats for Virginia are 2 to 3, birthers of color are 2 to 3 times more likely to die in pregnancy, childbirth, or postpartum up to a year after. We need to make sure these birthers are being heard. We need to make sure that they are educated, but we also need to have workshops to educate the providers, the nurse, the caregivers that's in the hospitals or birth centers.
So I'd just love to add on to that, just to answer the question about what can we do really. So some of the things that Anna said are absolutely correct. We need to increase education in a whole host of different ways. I think that also, as has been stated throughout this conversation, increasing doula support in general for all women or all birthers is going to be incredibly helpful to supporting what are truly kind of middling numbers for maternal mortality rates in the United States. Increasing service providers and doulas of color supporting women and birthers of color is going to be an important thing, because what we know is that when someone is working with someone who understands them in a fundamental way or can support them through a whole host of different issues that might be occurring for them, they're going to have better rates and better outcomes. And then finally, really focusing on postpartum. So Dominique is going to talk more about breastfeeding here in a minute. And so I think that that's a really important aspect as well, is how do we support women, not just in the birth itself, and not just as them or people of birthers as people walking into space and holding a vessel, right? Like they're not just having a baby, they're also going through something physically, mentally, and emotionally themselves. And how do we support them in the aftercare of that process?
So I'm going to speak a little bit about breastfeeding. Just to start off with a little bit of statistics. Again, so it is unfortunate that Black women or Black birthers have a higher more maternal mortality rate, but also too, the breastfeeding rate is low as well. And studies are showing that it's not because Black people don't want to breastfeed or people of color don't want to breastfeed. It's simply because the education, the support is not there. And from personal experience, I've seen and I've heard people say, oh, but they're Black, so they're not going to breastfeed anyway. And just outright not offer support or not as much support as they would somebody else, which is unfortunate because those parents generally are the ones that really want to do it. But also they don't know how to help themselves, so they just give up a lot easier. Which you know, I would do too if I didn't have any help, nobody was willing to help me. According to the CDC, Black parents are 58% less likely to breastfeed compared to non-Hispanic white people, and that's compared to everybody. We have the lowest breastfeeding initiation rate, and 58% actually has come up in the last 10 years. It used to be like 20 or 30%. So there have been some efforts, but clearly we're still at the bottom of the list with Asian and Hispanic parents being higher, but there's still some work that needs to be done just to kind of get us on an equal playing field. Also too, Black babies are 9% more likely to be offered formula instead of having their parents pump for them, or to be offered donor milk if they are in the NICU, because of that assumption that their parents aren't going to do it anyway, so there's no need wasting a lot of time on it. And that right there, the lack of breastfeeding is what gives our infants a high mortality rate. So yes, our infants have a higher mortality rate, at least by 50% compared to other birthers in our same communities. And as mentioned earlier, socioeconomic status, education, none of that matters. It's just the race that is the defining factor. And studies show that if our babies were breastfed, not even till 12 months, but even 3 months, 6 months, then it would significantly decrease the infant mortality rate. So some things that can be done. I did a presentation on this over the summer, and some of the solutions that I gave for these health providers is, one of the big things is support the low-hanging fruit, as we call it, or other organizations that are already doing the work. There's no need to reinvent the wheel. There are several organizations of color that are helping their own communities that you can then support their efforts to make sure that they're reaching everybody. You can also to support the Affordable Care Act, because the Affordable Care Act details in there that insurance has to cover breast pumps for parents. And in some states, even it's mandated for lactation education and lactation support. Once they leave the hospital, there's a certain amount of lactation consultations that they can get. And then also too, supporting the breastfeeding friendly, or at least the 10 healthy steps, because those are put in place at hospitals to make sure that every parent is being supported in their breastfeeding, and they have to go through each step before that baby is allowed to get formula. And some studies have showed that Black babies that are born in a breastfeeding friendly hospital have less formula initiation than if they're not. So really supporting that breastfeeding friendly initiative. And in the Roanoke Valley, we have one breastfeeding friendly hospital, and that's Louisville, Montgomery, and Blacksburg. And there's not a lot of hospitals here, but out of all the hospitals, there's only one in our area. And also to support skilled lactation care. This area needs a lot of lactation consultants of color. There's lots of different lactation support in this area, but skilled lactation care, that lactation consultant, IBCLC, somebody that has gone through the training, the medical training, to support parents in the hospital in that way, especially coming from the NICU, things like that, support people going through that. And again, that can include looking at those other organizations that are already doing the work, support their efforts. So those are some things that we can do as a people to kind of help the group of people that are needing more help, more attention.
Oh man, thank you so much, Dominique. I definitely did not know of all those different support opportunities. So that's fantastic. So I know we all are super intentional about educating ourselves and supporting birthers of color. But I have a question for a couple of you, because another people that need support and education and understanding is the LGBTQIA community. So I'd love to hear from a couple people what you've done or how you've changed your practice to be more inclusive of the LGBTQIA community.
So I can speak to that. And first, to go along with defining some terms like we did at the beginning, the LGBTQIA+, you may have heard of the IA+ or not, but that is a newer term that is aiming to be even more inclusive. And I will read to you the definition. A common abbreviation for lesbian, gay, bisexual, pansexual, transgender, genderqueer, queer, intersex, agender, asexual, and ally community, and that you may also known as queer. So the word queer is also used as a general term. However, as spoken of earlier, it's always helpful and respectful to simply ask how a person or a couple self-identify. So that's like your number one tip right there. So I do have some experience working with this community, and I have changed my practice. In fact, I cannot get total credit at all. I actually got an email out of the blue from an organization with LGBTQIA that they were looking to ask businesses to be more inclusive, and they pointed out that I use the word father a lot on my website. And I think husband. And I at first thought, oh, they're right, oh, more work. But I went through and I actually was able to really notice how many times those terms came up. And I'd actually already worked with a lesbian couple at that point, and I was able to think back, like, I wonder what that experience was like for them to work with me when my business ignored their reality and their choices in that way. So I did change the language, not only on my website, but on my intake forms. And I do sometimes have to self-correct. There are words like chest feeding that feel more appropriate for some people who are feeding their children breast milk. So being educated. I also say sometimes we are so excited to work with our clients. We just want, we want to learn from them and understand them better. But I realize too, it's my job to walk into those prenatals and into that birth, not relying on them to spoon feed me understanding. It is my job out of love to really do my research and understand more about what their experience might be like, and support them in any way I can. Let's see. I'll say that I'm also excited to be working on some resources for our communal website so that we can help other doulas, care providers, and ourselves easily access resources so we can give better care to the LGBTQIA community. And I will pass this on to whoever else wants to speak. Is Erin there?
I just thought you did such a wonderful job. I didn't feel like I needed to add anything. Sorry, I didn't say that. But anyway, thank you so much for sharing your experience, Tara. That was really helpful.
That was. Thank you so much, Tara. Yes, I think you really did cover all of it. So thank you. I appreciate that. And I appreciate your experience too. So I know that we all in RDC and just the doula community are obsessed with the idea that all people should have doulas, right? We all think it's so vital, so important, and we don't want any sort of community being left out from the opportunity of having doulas. So I would love to know what RDC is doing to currently expand services to be more accessible by more birthing people, maybe with different socioeconomic statuses that maybe can't afford a standard doula fee.
Sure. So just like Beth was saying, it is one of our big things we like to throw out there is that we want everybody, anyone who wants a doula should be able to access a doula. And we should be able to try and figure out ways that we can make it affordable and, manageable for families to be able to do that. And so thinking more on the side of the larger community goals and goals that a lot of communities have is really to make that accessible to anybody, regardless of financial means. There are lots of doulas and doula organizations that utilize grants and community fundraising in order to provide, to cover those fees. Some states even have Medicaid programs that cover doula services, and I know that Tara had mentioned that before. That's something that is huge. And hopefully that'll be something that it happens, across the nation at some point. As far as RDC goes and the individual doulas that we have here at RDC, we also have a lot of options to make it more manageable for people that are looking for doula services. And so all of our doulas offer payment plans. That's one thing. And I think a lot of, I think in our community, we are like, oh yeah, we offer payment plans. And like, that's not, it's common knowledge for us, but I think I've had clients who've gone, oh, you don't want all of it just at once? And no, that would be hard for anybody. And so I think really just making it so that, people have payment plans and can work with their, schedules and when you get paid and all of those sorts of things to make sure that your day-to-day life is not being hugely disrupted by this. And then, some of our doulas also offer scholarships and some offer sliding scales. Some even barter for services. And we also have lots of things to kind of think about in the future for how we'd like to grow that aspect of things. So we'll kind of go into that here in just a second.
Yes, thank you. Anna, I think that you had some information you gave a little bit earlier about workshops that we offer locally. Can you share about that one more time? Can't quite hear you, Anna. So sorry.
I always get that button. Currently, we don't have any scheduled, and mostly that has been because of COVID, but I see that we will We want to do workshops and outreach programs, not just for birthing people of color, birthing people of different genders, nationalities, sexual orientation, religion, socioeconomics, what have you. But also for providers, nurses, caregivers. We want to increase the birthing world for the best support of the birthing person. So that means workshops for providers, for nurses, so they can see a difference. A lot of them, they may know the stats, but they may not see how the stats are systematically enacted in the hospital or in the birthing center. I would like to have community-based workshops and eventually have grant-paid community-based workshops. And basically, we just need to get in the homes more, like postpartum. For any birther, you know, a normal 2-week postpartum doula, that's fine. But sometimes they need longer, 6 weeks, 8 weeks. Postpartum goes up to a year, so we need extra help in the home. You're going from taking care of yourself to taking care of yourself with just birthed a baby and a baby. You may be chest feeding, breastfeeding, you may be using cloth diapers, or you may be using disposable diapers. Those are things that needs to be addressed and helped. There's nothing worse than an overly tired mom or a sleep deprived mom who's trying to latch and can't, only because she's getting anxious, and the more anxious she feels, the more anxious the baby feels. So we just need to get in the homes more.
That's
Just
absolutely true.
Yeah, in addition to that, just if anyone wants to reach out, there are so many doula training programs in our area and in Northern Virginia, up in the DC area, that focus really specifically on issues around diversity and inclusion and have that as a major component of the work that they do in doula training. So please feel free to reach out anytime. We'd love to provide you with those resources if you're at all interested in supporting your friends, family members, or if you want to support the wider community as a doula.
Exactly. Thank you.
Awesome. Well, I appreciate each of you so much. Does anyone have anything that they want to add in last minute before we wrap up?
I did just want to throw out that as Roanoke Doula Collective, we have lots of goals for our future, and we are a very new organization and a very new group of doulas. And I think someone had mentioned before that COVID has kind of put a dent in things like it has in all aspects of the world right now. But what we have big goals, and we have things that we really want to do to increase access for care. And so, you know, eventually we want to start providing classes and getting some education out there, things that we as a collective are doing to provide for the community ourselves. And so we are really looking forward to that, and to being able to reach out into the community in a very real way, and less of a virtual way. And so that we can really get to know everybody and kind of be a solid part of the birthing community here in Roanoke.
Absolutely. Well, if no one has anything they want to add in, I just want to share with everybody that got to watch this video how to reach out to us. So you can find us on all the social media. You can find us on Instagram and Facebook, Roanoke Doula Collective. You can find us through our website, and through the website you can reach out to a representative from the group. But if you want to reach out to anyone individually through that website, that's an option too. And that is RoanokeDoulaCollective.com. We appreciate you, viewers, who hung through this long video. I know we all really wish that you learned something, about RDC, you learned something about what a doula is, how doulas can support you, and if anything, just to be a better person. So thank you so much.
Thank you.